I'm Dr. Amy Bend, and I'm doing some demonstrations for my patients to have better stretching techniques at home. I've some patients that have forward head posture, which means they're walking around like this or bent over. And so some patients are at a stage where we just need to start with some gradual stretching before we can move them on to the next level. So if you're one of these people and I asked you to come look at my videos, what we want you to do is get your back against the board and we want the wall, and we want to just start having you hold your head up. Now some people, this is not natural, so it's actually energy for them to hold and contract their head against the wall. But it's a good beginning, okay? So what you're going to do is you're going to attempt to do this for 10 seconds, and you're going to hold it, and then you're going to release. And then you're going to hold, and you're going to release, and you're going to hold for about 10 seconds. And then you're going to repeat it throughout the day for probably 40 reps, which is going to take around 4 or 5 minutes, depending on how much you pause between the rep. And so for my older patients, I say try to do 2 minutes in the morning and 2 minutes in the afternoon. Or if you just have a lot of curvature issues, it doesn't matter how old you are. If your body's more used to being like this than this, then we're going to gradually improve your posture by holding you. You're going to hold yourself up against the wall. You're going to hold and contract your trapezius muscles while you're doing this, and you're going to hold your chin back. And this is just a beginning to correct the posture. Another thing that we'll do to advance you is you'll use a yoga mat, or you may have been given a Roll. This is a posture device we use in our practice. And so what we'll have you do is use something like this, or a Roll, a yoga brick. And you can take it at whichever size that you think is going to help you. And I'm going to just put the back against the wall, and I'm going to just push and use it as something to push against to get my chest forward and my head backwards. And it's going to also stretch out my trapezius and my thoracic spine and help me start elongating my neck and getting me out of the trend of forward posture. You may need to lower this depending on where your forward posture's at. I had another patient yesterday, his posture was bent over in the lower back. So I suggested that he use the brick lower and get his upper back backwards, because that's where he's bending over to alleviate his back pain. So, but for upper back and neck areas where you're going forward, your posture is moving in that forward postural momentum, we'll put it up behind the shoulder blades and use this as a form of resistance. And you'll hold for 10 seconds and then release, and then hold for 10 seconds and release. So this is a great start for getting your forward posture to diminish. Given enough time, your body can change and correct. You just have to practice being in the correct posture first. Now, of course, if you have diseases and so forth that have fusions in your spine, you may want to have x-rays and other things to make sure that you qualify for this type of stretch. So use your common sense. I'm Dr. Amy Bend. I'm in Arroyo Grande, California. Our website's Arroyo Grande Chiropractic, and our phone number is 805-4747 if you have any more questions about posture and correction.